So, but
Morning.
husband and kid are off to daycare. So good morning, everyone.
Good morning, everyone.
Hi.
Good morning.
Hey. I did send via email, I sent a copy of a PowerPoint slides as well as a handout. But the handout really is duplicate information with some of the info on the PowerPoint slides that you can use throughout the presentation. Sometimes it's hard to see some of the text examples I'll be using today in the webinar on the screen in Zoom. So you can look at them on a different device, or if you want to print it out, however you want to handle that. I'm also sharing the PowerPoint slides with you before the presentation. Some folks like to take notes on the slides, so you can do that if you want to. I'll also upload all this stuff later on the Moodle platform, as well as with some follow-up exercises, but probably not for another few days. But once it's uploaded, I'll send an email out for everyone to go and check, because there'll be some small activities to do between this and the next session in 3 weeks, just to kind of practice some of the information I'm going to review with you today. Okay, Henry, do you want to say anything else?
I don't think I got that email you sent out.
I just sent it. Let me make sure I sent it to everybody.
Oh, you just sent it?
Mm-hmm.
Oh, I see. Okay.
Yeah, I just it probably is on its way through.
Yeah, right. I see it now. Okay, very good.
Yeah.
Okay, thank you for doing that.
Sure.
And all right, so I think let me just let's see. We'll give it another minute.
Sure.
Just
So everyone, check your emails. I sent, for those who just logged in, I sent the PowerPoint slides as well as a Word document, a handout for today's session to you. So if you want to use the PowerPoint slides to take notes in them, some folks like that, or you can use the handout as well. The handout and the PowerPoint slide have duplicate information. Just, you know, I like to send a handout when I'm giving a webinar. Sometimes it's hard, as I said earlier, to see I'm using a lot of text examples, like examples for different articles, and it's hard to sometimes see that on the Zoom screen, depending on your on how you have your computer set up, the size of your screen, and so on. So you have another way to access some of the information during this webinar. And of course, for those who are watching this afterwards, you can just, you know, look at the PowerPoint at the same time while you listen to the webinar, whatever you like.
right. Okay. Very good.
Thank you so much.
This webinar is being recorded.
Excellent.
And so if you miss something, no concern, no worries. All right. All right, Isabel.
I'm ready. Yes. Let me just I need to open the one thing I haven't done yet is open the actual PowerPoint on my computer. That would have been helpful. So I'm going to start sharing my screen in a moment. Just briefly want to give a quick overview of what we're doing this and next year, really, for the next year in terms of writing. So we're starting today with the webinar, and then we have one every 3 weeks, same time, always Mondays, 8 a.m. So, and I mentioned this earlier, for those folks who weren't on there, I'm going to be here on time. I sometimes might be a minute or so late because it's 8 o'clock here in the morning, and it's the time that my son goes to daycare, and so my husband has graciously agreed to take him to daycare, and they're on, you know, we're still working on our routine on this, so it might be a little bit wonky for the next few times, but I'm here for sure. So and we're gonna so every 3 weeks until I think early December, then we're going to take a little bit of a break over. Here is our Christmas not well, Christmas, I'm Christian, so I celebrate Christmas, but it's a winter holiday, end of December, our university is closed, and we'll pick it up starting sometime in January. And then all the way until May. And we're going to focus in these first sessions. We're really focusing on in sessions this year mostly. We're focusing on the main genre for scientific publication, the IMRAD article, right? Introduction. And I'm going to talk about this in a second, a little bit more in detail. And we're going to dissect and analyze different parts of papers. The next two webinars, we're actually going to look at sections, whole sections of some articles. And you're also going to be doing some work in those 3 weeks in between. There's some activities I'm going to put up on Moodle. I'm a little late with this one. I was hoping to have this up by this morning, but didn't happen. So I'm going to upload it sometime this week. And I send an email out when it's ready for you to do some work on, some discussion forums, some analysis. And it's really meant for you an opportunity to practice some of the material we review together in these webinars in between, in order to assist you with your own writing process of your own manuscript down the road. And down the road isn't really that much more down the road, because it's going to happen sooner rather than later. So that's the structure of these. And then later on, like starting later on this year, early next year, we're going to focus, as you start writing, most of you will probably start really drafting your manuscripts by sometime, between now and the end of the year, early next year. We're going to look at some sort of effective writing principles on a sentence level and paragraph level. So we're going to do some really fun work around that. That's my favorite. I mean, I love it all, but I really love that kind of work. So we're going to start broad and then get a little bit more focused on, sentence structure, best ways to organize a paragraph, certain expressions to avoid, certain expressions to use, active versus passive voice, all that kind of stuff. So we're going to do a lot of fun things around that. All right, having said enough, I'm going to start sharing my screen. You should all be seeing a PowerPoint, and I'm going to go into the presentation mode, change my display settings. So please use the chat function to communicate with me. I'm going to open that up in a separate window, so I'll have it in front of me. I'll try to, if there's a question there and I see it, I'll try to answer it right away. I might call on you to if you want to speak it, you can talk as well. But if you have a question about anything I say or something you want me to reiterate or go deeper into, let me know via chat. And I have a few things throughout the webinar where I'm going to ask stuff of you as well. But it's an hour, less than an hour now, so I'm going to want to get through this so we all can go on with our days. I know some of you, for us, Henry and me, it's early in the morning. Our day is just starting. For some of you, the day is ending. So I want to honor that as well. So we're focusing today on the methods and results section. So we're not going to go in the order that the articles are actually written. And there's a reason for that. A lot of research and a lot of practitioners of scientific writing tend to start as they're, carrying out their research, collecting data after having gone through a proposal stage, gotten approval for their study. You start collecting the data. The best way to get started writing your manuscript, or the most effective way for many, many scientific writers, seems to be to start with the methods and results section, because it often is, quote unquote, the easiest section to start, especially the method section, because you know what you've done, right? And it's just really describing what you have been doing. And it's even something that I would encourage you to think about, maybe drafting out even now, as many of you are still in the proposal stage, because what you're proposing in your proposal will probably look similar to what you actually be carrying out once you get approval and so on. And some of you might have already gotten approval. I know somebody is writing a systematic review, so it might be a slightly different process, and we can always communicate with that individually. I forgot who does the systematic review, but I saw it the other day in an email. But we're focusing today on methods and results section. There we go. Before I do this, here, just want to give a brief overview of the IMRAD format, just to get us all on the same page. I did mention this before in our session that we had all together in the summer. But the abbreviation IMRAD comes from the first letters of the four main sections of most research articles: introduction, the I; methods, the M; results, the R; and discussion, the D. And there's, of course, the abstract as well. And we'll talk about abstract writing a little bit later as well. But the A for the abstract doesn't really fit in so nicely into the four-letter abbreviation for IMRAD. So that, but known abstract, of course, is part of it. And also in some journals, especially a lot of journals that have a broad audience, a general audience, like some of the major high impact journals in medicine and healthcare, now start also having on top of abstracts some sort of I think Cochrane uses a terminology for that, calls it like summary, general plain language summary, or some bullet points. So there's some other things that are happening based on the journal, and we'll discuss that when we'll talk about abstract writing, because that's part of that kind of subgenre. And so in general, the IMARC format, if you look at my wonderful wonderful little annotation over here, it looks like an hourglass, right, where the sand kind of goes. So I was trying to look for a nice image and I couldn't find one, so I just went with an abstract, 2 triangles. But it's the inverted triangle. We start very broad in the introduction. We narrow down in the intro to a research question or hypothesis, and then we get very narrow with our results and our methods, and then we get broad again. This is where the triangle right on the bottom broadens out again in our discussion section, with really finishing our articles in a sense like, what's the big implication of this research? Because all of us are working on smaller pieces of a larger conversation, right? And that's our job, to link that together. And we'll talk about this in detail in 3 weeks when we'll discuss discussion section. It's one of my favorite parts and probably one of the most difficult parts for many folks to write. And we'll chat a little bit more about this later. Let me clear my drawings here. So today, as I said, our focus is on methods and results. And that's really the narrowest part here. I circled that for you. That's the narrowest part of the article. And by narrowest, I mean it's the most specific, and it's the most, and it's also in a way detailed, but we'll talk about managing level of detail and also not writing, not writing too much. So, and that's the tricky part about especially the method section. So having said all that, I'm curious to hear from you, because many of you have already published and written many methods and results section, and you also have read many of them. So I'm curious, if you think back, as you have been writing methods results section, as you've been reading them, what are some things that you've noticed? What are some things that most writers do in methods and results section? What goes in there? What do people, what do you do when you write your methods and results section? What do you put in there? What do other people put in there? Just want to kind of get an idea of where folks are with that. So put it in the chat, and we'll take a look at that together. And then we'll go, and I'm sure you guys are going to hit on all the things that I'm going to mention to you. So yeah, let's be very specific in terms of writing what exactly to perform the study. Yeah, so exactness is a good term, like to be exact. And the goal, of course, is to technically, right, somebody else could reproduce your study, right? That's the hallmark of scientific work, is that you're not doing something that I couldn't do as well. And so that our results should be reproducible to a certain extent. Morning, Jeanette. Or evening, that's right. Or afternoon, whatever it is. Yeah, so specific exactness, those are good things to keep in mind when it comes to that, to those sections. Tables, graphs, Asma. Go ahead, Jeanette.
Apologies for that. I was actually in the middle of typing something else, and I pressed the enter button. So the good morning popped up out of nowhere.
That's all right. And Asma saying tables and graphs. Yes, so the methods and results sections, especially results, are usually, you have tables, you have graphs, you use visual, you might have, Western blots, whatever it is based on the nature of your research, right? So, but there is usually some visual element to interpretations is interesting, Asma, and I'm gonna say something about this a little bit later on, because we have to be careful with what we mean by interpretations. What you don't do in the results section is to provide actually some analysis of what the results mean. That is reserved for the discussion. So you do describe and explain some of the results you have and you have achieved, but you're not really getting yet into what they mean necessarily. So that's an important distinction we'll talk about today, and particularly in 3 weeks. Be a right method section, a clear and detailed way. Yeah, so clear, straightforward language is really essential. And this is not the part, the methods and results section are not the parts you have to worry so much about. Oh my God, does it, I mean, it needs to flow in a certain way, but it doesn't have to be as narrative or as coherent a story as the introduction and discussion section have to be. It's really about we did this, or this was done, and we found, and this and this, and we found this, and some explanation. So it is not the most exciting part to read, honestly. And I'm sure Henry would agree from a reviewer perspective as well. I mean, those are methods and results are important, right? They describe what you've done and what you found. But from a reading quality, they're not the ones you have to really think about great style as much as probably the intro and discussion sections. Rationales for using those methods. That's a good point, Asma. Yes, some explanation why you use a certain method, unless the method is really standard in your field. But if you're doing something a little different, and for many of you doing sort of qualitative, quantitative, mixed methods analyses, that is usually, it's a big part of that, explaining why you chose a certain survey, explaining why you're doing focus whatsoever, and so on. And results highlight the most significant results and answer the study questions. Yeah, you got it. Absolutely. So it's really kind of straightforward. I wish, it would be so easy to write, right? As just to writing about it. But you're absolutely right. The results really highlight the most significant results that answer your research question. And sometimes if you conduct a study, you might end up not using all of the results for one article. You might actually publish several articles, depending on the breadth and the, of your findings. Methods of recruitment, determination of sample size, exactly. Those are all very specific, need to be reported in the methods section, because especially for many of the studies that you folks are doing, where you're recruiting participants and then, making sure, because that's often a point of critique, isn't it, by reviewers, like, oh, the sample size was not big enough to make the conclusions you do. And if you explain why you might have a small sample size, if you address it, that's certainly feasible and very very common. Anything else, folks? Those are all great things. There's one. Oh, there it is. Direct answer to the question, but I was wondering what the level of detail, the level of detail with respect to describing a questionnaire that you should include in your methods, as you mentioned earlier. That's an excellent question, and I'm gonna address that a little bit in a couple of minutes. That's an excellent question, and it really is sort of a balance act, and we'll talk a little bit about it. Great question, Isaac. Yeah, I usually skip the method section as a methodology term. You know what? I really relate to Isaac, and unless I have to review a paper, then I have to kind of read it, right? But if I read it for my own, like I'm trying to use it for my literature review, for my work, I might not always pay as much attention to the methods, because I'm hoping it has been published. Somebody has done that, but it's not the most. I sometimes even skip the results. I just go, like, I read the intro, or sometimes I go right to the discussion. I might skim the intro and I go to the discussion section. And if I read the discussion section and I'm not really, I'm missing something, then I often go back to the results and methods. So I use the methods and results as point of reference to understand the discussion section. That's my reading practice of many articles. But again, when I'm reviewing, it's different, because then I have to say something about the quality of the methods, right? I mean, that's why I would never be asked to review a paper in your journals, but in the journals I publish in, I have expertise in the methodology that I use in my studies. Okay. All right. Very good. Good stuff so far. So I'm going to keep that in mind about the questionnaire and the level of detail you need to provide. And the short question, a short answer that is like, it depends. But I'm going to say a little bit about what it might depend on in a moment. So let's talk about methods, other terms that folks use, and also different journals might use, especially journals that are more also intersect with social science kind of type of research, which some of you are intersecting with, especially if you're doing like survey-based research and some more public health oriented research. You might look at journals that are intersectional or interdisciplinary with social sciences. Some of the journals call it methodology. Some call it materials and methods. I see materials and methods a lot in, like biochemistry, chemical journals, because it's about the materials, like the cell lines, the whatever, the things that I don't really know too much about. But materials or methods and materials, people switch it around. Those are the most common ones I've seen. I'm sure there is another term out there by some journal that they came up with, but methods usually captures it all. Just want to throw that out there. So let's talk about the methods section. I put a couple of bullet points down here, and that I think are sort of key things to keep in mind as you're starting to think and maybe even draft your method section right now or shortly as you continue, as you start carrying out your research. And I really suggest, as you're carrying out your research, start writing your method section. You can always rewrite it, doesn't hurt, you know, but it's easy to do. And it also gives you a sense of like, hey, I'm already involved, a sense of accomplishment. At least that's how I feel, because writing isn't always my easiest thing to do. Like, oh, I got to write. But you already, in your mind, you already started writing your paper. So start writing down your methods as early as possible. And it's really sort of the overall view, as I said, overall point is to give your readers a clear overview of what you and your research team, it's rarely just you, what did you do to get your results? That's sort of the nitty gritty. Jeanette, was there a question? I saw that you unmuted yourself. No? Okay, excellent. And it's really, and the level of, and this is the balancing act. And Jeanette, your question kind of gets there with the questionnaire, but I'll go into more detail about this in a moment. In general, it's a real balance act because you have to provide enough evidence that other scientists can say comfortably, I could replicate this study, right? So it's legitimate, because often, you know, journals that don't go to a thorough peer review process, or where the peer review process has been compromised, often the papers don't really give readers a clear idea of like, what exactly did they do? Because reviewers will catch that, like, wow, we need more information to fully understand how you got there. So some of that will also be part of the review process with the journals you're submitting to. So you want to include enough information to do so, but you also don't want to give unnecessary details. And so Jeanette, with your question about a questionnaire, so let's say you're using a questionnaire or a survey that somebody else developed, and you maybe change some questions because they would fit your purpose more. You want to explain what you've changed, but you don't have to, like, you know, write out you have a 40-item questionnaire. Please do not write all the 40 items in that questionnaire in there. What you could do is, as a supplemental material, you could submit you know, a copy of the survey, and some journals might actually ask that, or you could provide a table, you know, with the questions in the survey, if that's something, but usually, you know, so you have to kind of, in the actual text, you don't want to go into too much detail. How should we write when we reproduce others' published ideas using our own data and method section? Kwa, you asked, let me look at that question again. Let me try to understand this. And I see your question about reading. I'll get to that in a little bit. How should we write when we reproduce others' published idea using our own data and method section? So let me make sure I understand the question. So you're in your method section, you have used somebody else's method. Is that your question? I don't know if you can either in the message explain a little bit more, if you want to unmute yourself, because I guess I'm not understanding quite what you mean by reproducing others' published idea, what idea means.
So I would like to know, so some people already publish their idea and they write detail in the methodologies. So I would like to reproduce this idea in my own country and I call it data.
Oh, so you're using,
how can I?
Okay, so you're using somebody else's study design and use your data in your country, correct?
Yes.
So you would just cite, like, you know, we used this method as developed by, I don't know, Smith and Johnson, and you cite it, right? You give people credit, like you use this methodology, and then it's a good question. How much detail do you have to provide about the methodology? And if you might need to describe the methodology as well. You know, it kind of depends on, so let's say you're publishing it in the same paper that these other folks have published, you might not have to provide nearly as much detail, but just because you're using somebody else's methodology or like their study design, and you're replicating it with your data, you still have to describe the study design, because you don't want to assume that your readers know the exact, they might not be familiar with that study, but you will need to reference that it's based on this study by other people. But you would still have to provide, you know, a general description of how you know, manipulated your data, how you collected your data, your sample size, and so on. So you kind of have to reproduce it, because you really want to make sure that your readers understand how you got to your data, okay? When it's a questionnaire already existing, should we mention just the name and the addition of the questionnaire and method section? Should we mention the questionnaire different subsections? That's a good question, Nawar. I don't know how to answer that because it depends, right? So let me say what I mean by it depends. So I think that the minimum is to say we used, survey X developed by these people, citation, right? That's the minimum. But if you are if the different subsections are important to your analysis and to your results, then it might be useful to mention in the method section, this survey has, 4 different subsections, dimensions, and list them. Or you could say the survey has, 20 different subsections, see figure or table 1 for the list of all of these, right? And then, you can use tables to capture some of that information or figures. I hope that answers your question.
Isabel?
So go ahead, Jeanette.
Yes, I think it answers mine as well. That
Was your, okay, excellent. Yay.
Two at one time.
Very good, very good.
I was going to ask you about that. If you have different sections, so for example, in a questionnaire, you have a section on, socio-demographics, and then you have something on attitudes towards something. Then would you, so that helps, because I'll just say a detailed description of all of these are in the table on so on so on. Supplemental materials.
You're absolutely right. So I'm trying to think, I don't have some of these examples in here, but I'm going to do some activities, some Moodle activities for you guys, and I'm going to put some different examples of some of the things that you're asking about, because those are really important things. Like how do people present different surveys? And so I think a lot of it is driven by, and I'm trying to think of one of the surveys that Henry has done, and I think we're using an article in some of the other sections. And it was a survey-based study on I think the level of academic misconduct in some, I think, Middle Eastern countries. I'm not quite sure what exact geographic reference was. And I think the results section was also organized by the different areas, different parts of the survey. So that's very common. So the good news is that you really have a lot of say in how you organize these sections. The bad news is that you have to figure out what the best way is for the reader. And that can mean sometimes switching things back and forth. So you might go back and reorganize your method section as you start writing your results section, and especially as you start interpreting, analyzing, and providing analysis for your results in your discussion section. That might kind of influence, you might need to go back and do some rearranging. And that's something, as you're drafting, I will work with you on this, and so will the other folks in the group, and we can figure out the best way. What's the best way to present your material? You have lots of options, which is great, but it also can be a little overwhelming. So enough to cite the source of the questionnaire without having permission. That's a good question, Jeanette. Sometimes to actually get the questionnaire, you have to contact. That's been my experience. I've done a couple of survey-based studies with colleagues, and we've contacted the folks who developed the survey, and we said, hey, listen, we would like to use your survey. Can we? And they gave us permission. And so, Henry, how is that commonly? How is it usually? That's how we handled it in our situation. You want to add something to that?
Questionnaire is provided in like the supplementary materials, then it's in the public domain, and I feel I don't need to ask specifically for permission to use the questionnaire. And now, if they haven't provided the questionnaire, then I would write to the authors, and I would always get the questionnaire. So again, if it is provided in the supplementary material, then it's in the public domain. Just like now, a lot of journals are requiring authors to deposit their raw data in a public file. So again, everything has to be
transparent.
Yes, right. Transparent and available. Right.
Yeah, that's a good point, Henry. See, when I was working on this, it's a long time ago. Like I've done this survey based work with some colleagues, and so that was before journals had online repositories. So I think that's, you know, so I agree with you, Henry. If it's in the public domain, you know, you just cite them, right? You have to always cite them. So it's very, very important. No, it's in the public domain. I can just take in whatever. No. You got to give credit where credit is due, because you would want the same thing if someone uses your survey. You want that citation because it also, you know, affects your H index, right, and your citation index. So it's all important to do that. But if it's you know, publicly available, as a courtesy, I mean, I sometimes think as a courtesy, you could send the, you know, the first author an email just saying, hey, we're using a survey for the study. Thank you. It's really great. You know, just kind of, you know, but it's not necessary to get permission unless you can't access it. Then you have to, of course, ask for permission. But the citation covers you in terms of, you know, giving due credit where due credit is due. All right, so let's move on. So and just with anything that you write, oh, Jeanette, apply to other items, illustrations. Yes, absolutely, same thing. So it is, you know, you always need to give credit, and I'm not always a great example. I have used some sort of comic strips in some of my PowerPoints and did not cite the source. And one of my students the other day said, you know, Dr. Mayer, you don't really practice what you preach. I'm like, oops, right. So in publications, of course, I do. So if you use an illustration from somebody else, you do want to cite that. But if it's published somewhere else, if you want the original version of it, you know, I personally, this is my personal preference. I always like to let the authors know when I'm using somebody's, you know, illustration of something, just, you know, just to cover my bases. But copyright wise, and especially with journals, if it's an illustration published in another journal, you know, there might be some copyright issues with the material that you kind of just want to kind of clear. So that would be my suggestion of that. But I'll try. I think there's a blog post somewhere that I came across about this, and I'll make sure I'll post that in our resource section on the Moodle section around this as well. And so I'll alert you to that. So going back to the methods section, we're doing all of this, like all of the, like, what do we cite? When do I put this? Do I, you know, cite the illustration? You know, this, where do I put it? How do I have to describe the dimensions? We do this so that our readers have an effortless experience reading our work. That's always the main goal, right? It's really for our readers to experience have an effortless experience as possible. And reviewers will always, you know, and it's really like your main audience, right? Initially is your your reviewers. And you don't know who they are, but they're going to be colleagues, experts in your field. So you want to make sure you want that. When I say dimensions, I meant what you mentioned earlier, dimensions of like a survey, like certain sections or dimensions. That's what I meant by that. So organizing the information for your reader. There's a couple of ways to do that in the methods section. I'm a big fan of dividing methods section to subheadings because, you know, like I'm trying to think of, I have some examples a little bit later on, like statistical analysis, samples, whatever. So depending on the data you're collecting, certain subheadings will make more sense than others. But think about like small little sections, and, you know, you'll see this in many of the articles you're reading and consuming on a daily basis anyways. Subheadings can be really helpful. And I mentioned cite commonly used methods instead of writing about them in great detail. So if it's a commonly used method used in your field, you don't probably have to explain what it is. But sometimes you might be surprised. Reviewers might come back and say, I think we need some explanation here. So you got to really be savvy about thinking who is going to be the main readership for this article in the journal you are targeting for publication. So there's a lot thinking that needs to go into that as you're preparing this. That's why I think it's important, if you haven't yet, today is what, September 13th. If you haven't yet, if you don't have a list of like 3 to 5 journals you want to submit to, you need to have those by the next time we meet. You really need to have a list of journals that you're targeting. You might not publish in them ultimately. You might find some other ones a little bit later on, you know, like 3 weeks down the road, you're like, oh my God, there's journal X. That's fine. But know now that there are 3 to 5 journals that you want to target to send your manuscript to, because that will also help you determine as you're writing that some of the level of detail you'll have to put in or you can leave out. I like flow diagrams a lot, and I'll show you some examples. They might not always work for every study. I have an example from a large clinical study that I think is really helpful already in the method section, especially if you have a lot of groups, you have your control group, and you kind of putting them in different sections, or you started off with, I don't know, in this example, it's a Taiwanese study on diabetes, and they started off with like 1 million people, and they ended up with 500,000 people. And so they show in this flow diagram how they ended up with the number they had. So again, that might not be applicable to you, but if you have a large number of large number of people who are participating in your study, it might be helpful to have a flow diagram describing how you ended up with your sample, rather than having to describe it in great detail in text. You could use that. Yildiz, what don't you understand commonly used methods? Talk to me about this. I'm not sure what you don't understand there.
I don't know what you mean, but commonly used methods, that is mean the quantitative or qualitative method, or
either Yildiz. So whatever method. So let's say, for example, I publish a lot in journals for writing pedagogy, but I've done some work where I've and so in writing pedagogy we don't use a lot of statistical analysis. So, but I've done some work where I've used some data and I compared it with like a t-test. And so I had to explain what a t-test is in greater detail for that audience, because many of them, or very few of them, have a statistical background. But in many medical and biomedical journals, or in your field, you don't have to describe what a t-test is. You just say it's a t-test.
T-test or F-test or whatever.
Exactly. So this is why it's important. You got to think about, is this a method that is used widely in our field? And so my audience will easily know what it is. Great. If not, you might have to explain it more, and you might have to provide some extra explanation.
I got it. Thank you.
Sure, absolutely. Yeah, I mean, I believe you. Flow diagrams are excellent to show sampling, attrition, and retention. Thank you for giving me that. I could not think of those words. Attrition and retention. Absolutely. So they can save you a lot of space writing. Because if you have to explain how you get from 1 million people to 500,000 people, that'll take up a lot of space. So you can say, hey, this is how we started this, we ended off. Look at this diagram. This flow diagram for more details. Boom, and you're done. So that's helpful with those. So I mentioned earlier that method sections aren't the most like, oh, everybody should be able to understand these. I mean, ideally it would be great, but the reality is that unless you're really familiar with the field, the methods and results sections are going to be hard to understand, right? I was reading an article the other day in an educational journal, and I was like, I have no idea what the talk was about. Doing questionnaire, devising, what was it, multiple choice questions, and making sure it was very, very complex. I can't even reproduce it like talking about it, but I could follow the general idea of the methods and results section. So I was organized in a way that I could follow it. I just wasn't very knowledgeable about the contents as much. So what I'm saying with this is jargon and passive voice are fine. And by jargon, I mean discipline specific terms. Those are really the ones that, you can use those a lot in methods and results. And passive voice, the survey was conducted. I'm a big fan of using "we conducted this survey," but you also don't want to use it in every sentence. I'll show you some examples of that in a moment, how you can mix passive and active voice. But don't worry too much about trying to have as little passive voice as possible in methods and results, because that's not the place to really pay attention to that. I'm a big proponent of using active voice as much as possible, but I think it's more important in the intro and discussion section than necessarily in the methods and results. So that's just want to preface that. You posted, yeah, that's right. So I'm glad you put the equator network on there. I have it on one of my slides as well. That's where all the reporting guidelines for either systematic review, for there's some qualitative stuff on there. There's, the typical sort of evidence-based randomized control trial and so on. I have some of those in this, later on as well. I think that they're very important for methods and results, because often journals use those, and journal reviewers use those reporting guidelines as a checklist as they review your work. So you can use those, you have to use those, of course, to make sure as you're drafting and as you're conducting your study as well. So thank you for that. I'm going to, I think I have the equator one, the link in there. If not, I'm going to make sure I copy that. Important components of materials and methods section. Just to give you an example, this is from an article in the Journal of Human Reproductive Sciences. So it comes from that disciplinary background. And you have the link here if you want to check it out. So those are some of the things that the author mentions that are common components in materials and methods section within human reproductive sciences: study design, participants, ethical approval, informed consent, protocol, data collection, blah, blah, right? None of this should really be surprising to you. Those are the common sections in the methods section. And most importantly, method sections are almost always they're written in the past tense when you're describing what you've done. There's a few moments where you can describe things in the present tense. I'll mention those in a sec, but it's all like, we did this, we sampled this, blah, 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 blah. Past tense, pretty much all the way through.
Go
ahead, Henry.
You raise a good point about past tense, but I can't remember who I was. I was discussing this with Katrina. I don't know if she is on the line, but we talked about how if you're writing a proposal for the IRB, obviously the method section will be in the future tense.
Correct. Yes, because otherwise they're like, wait a minute, we're proving something. Yes. And it's almost, and I actually, the suggestion that I make to folks, when you've written an IRB proposal and you get the approval and you start doing your work and, start writing up your method section, use what you've written in the IRB approval, switch it to the past tense. That's your first draft of your method section. Boom. You already started writing. Woohoo, right? So yay. So you've already started your manuscript even without, even before you were, while you were being approved for IRB. So you switch the tenses from future tense, we will do this, we're proposing, to past tense, we did this, as you, of course, doing it. And then, of course, as you're conducting your study, there'll be changes and slight tweaks, and then you can address that in your drafting and your writing process of those sections. Thanks, Henry. Yeah, I usually mention this and I have forgotten. Yeah, so future tense for proposals, past tense when you've actually done it. So don't use future when you're submitting this to a journal, because they'll be like, what? We're not interested in something you will do. We want to see what you have done. Because you won't have, right?
That's the Journal of Future Studies.
Unless I don't know if that actually exists, that would be funny. So common areas to cover. Those are, I think, standards: materials, participants, subjects, experimental protocol, study design, and any kind of measurements, dependent, independent variables. If you're using a survey, explaining the survey in greater detail. So, those are common 4 areas, but they can vary in depth and in definition, depending on the design of your study and the content of your study. Okay. So materials might not always be the best term to use if you're using survey-based study. You wouldn't probably use materials. You might just use the heading survey or, something. This is a really nice table, and it comes from a journal called Clinical Chemistry. And I think I've mentioned this before. It's a whole series of articles on scientific writing. They're short. I use them in my teaching all the time. They're wonderful. Thomas Ainsley goes over basically like 4 main, there's this 5 main questions. Is it 5? 1, 2, 3, 4, 5, 6. Who, what, when, where, how, and why, right? That's the essence of your method section. I should know who is participating, what's being done, when is it done, where was it done, how was it done, and why was it done, in the sense of why did you choose, a certain method over another. And in this case, of course, again, bear with this example because it comes from clinical chemistry. Why was a species chosen, mice versus rats? I don't know any of you will use actually animal studies. So, but why did you choose your certain participants? So the why question is about justifying why certain methods, why you chose this method. We chose this method because it's, whatever, common. And if, especially if it's something that's a little unusual, providing an explanation in your method section will really reduce some of the feedback from reviewers, because that's a reviewer feedback I see a lot, where writers assume, of course this is the best way to do it, but the reviewers are like, not really, like, why is it? And it's, from a reader's perspective, it's nice to know that, right? And it kind of it provides another level of transparency why you're choosing something over something else. So I think that's a often underwritten, or it's a part that's often gets overlooked in method section. It's the why you choose something. So it's a great table with some questions. Some of them might be more applicable to you than others, based on the nature of your research. But I like that categorization of who, what, when, where, how, and why, right? So if you keep that in mind as a checklist, that's also a nice way to help you structure your method section. Some sample subheadings. This is from a survey study. So sample subheadings: a study population, survey instrument, analysis, statistical versus qualitative. So pretty bare bones, right? So this is from a study from BMC Medical Ethics, an Ethiopian study. So just one example. Another example, this comes from also from BMC Medical Ethics, a cross-sectional survey study, similar but designed in participants. And so this survey study was divided into two audiences, the general public and physicians. And you see this reflected in each of the subsections in the method section. One discusses general public and physicians, general public and physicians, general public, because it's a comparative piece between these, between the public support and physician support for euthanasia in people suffering from psychiatric disorders, right? That's the nature of the study. So that's one way you could also organize your method section by, if you have different populations, you can use the populations to help your reader, or it help organize your section to make it clearer to your reader. Let me clear my drawings here, close this up. So just some examples. Citing commonly used methods. Some folks were asking about this. So if you look here, this is from Journal of Academic. This is Henry's study. There we go, the cross-sectional survey study. That's the one that we're going to do some work with. I knew I had an example in here. So this is was published in 2018. So here, this is, I really like this paragraph because it goes into, we adapted a list of research misconduct practices from those used in several studies performed by Martenson and colleagues. So right here's the citation, right, check. And then specifically these authors, so here is a quick description of what this survey study did. They divided these 6 focus groups, and then there's an adapted list of misbehaviors. We constructed the following research misconduct composites. So it explains very clearly how, and of course, you don't know the whole study, so it's a little hard to understand, but trust me, it's very clear within the context of the section. Your table lists the specific misbehaviors for each of these components, right? So Jeanette, here is a good example of like, hey, here, look at table 2. There is some more information about these composites that we constructed based on existing surveys, and we adapted some of this information. So, detailed description, but not too long, and relying on a table to provide additional detail to your readers, so that they can follow and can understand what exactly happened. Henry, do you want to, I don't know if you're on there, if you want to add anything since you've actually written this?
No, it's, I'm glad that you think that it's well described, because that was our aim, and so it apparently it worked out well.
And then another example on the bottom here from a more sort of less social science kind of survey study, but this is from like PLS01, reduced on whatever it is. So we use the same standardized protocol for this, spectroscopic imaging as described in detail previously. And here the citation is a different format. You might notice that here is in a parenthetical citation with the name of the author, and here it's called, it's usually it's APA style. Oh, sorry, my handwriting with the mouse is terrible. And this is AMA style, the American Medical Association versus the American Psychological Association. We just use the numbers. Whatever you use will depend on the journal you're publishing in. Very simple. And we'll, if you need some support with that throughout your writing process, we'll talk about it. I'm not an expert in all of these, but I've dabbled with all of them, so I can provide some guidance there, and we can certainly muddle through it together. But right, so this is a good example, very short, like, hey, we use the same standardized protocol for this as previously. And this might actually be, and I will need to look this up, this might actually be a study published by the same authors or some of the same authors. So if you have done a similar study that has used some of this methodology, you can cite some of your own work. Don't do that all the time, but it's perfectly fine if you have worked on this, or let's say you publish another article after this one that builds on this, you can cite your previous work as like, hey, this is a common method described over here, right? If you feel like your readers don't need to know all this detail, they can go look it up if they need to. And again, the determination you need to make on a case-by-case basis, depending on where you're publishing and who you think your main audience is. And again, sometimes your reviewers might disagree. The reviewer might be like, we need some more explanation here. And then, of course, you provide it in the revision process. Clear my drawings. There we go. So some examples for that. Oops, let me go further. I was hoping, okay, we might need to do another section on this, the results section, because we're getting close to the hour, but that's okay. Here's an example of the flow diagram I mentioned earlier. So this is from the study was published in Drug Safety, large clinical study. So you see in detail how, they divided all the different people, how were they excluded? It's based on particular types of drugs. So here is the description of the different groups based on the different drugs and the different whatever subsections of the drug, whatever that all means. Again, I'm not a content expert in this, but you get the idea of what these flow diagrams look. If you do a lot of clinical studies, this looks very familiar to you, and you're well versed in that. But sometimes something like this can also help in the survey study, where you can sort of explain the flow of like participants, rather than having to if you had to describe all of this in a paragraph, it would take up a lot of space, and you don't want that. It's not necessary. Okay. Let's see. Tends to use, I mentioned this, so it's past tense about what you did when you're writing your manuscript, future for the IRB approval. And there are some moments where you can use present tense, even in the method section. So not everything has to always be past tense, but it depends on what you're writing. So for example, if you have a sentence like data are presented in the following way, or table 1 shows, right? Table 1 shows is always going to be present. It's not like table 1 showed, because it's showing it right there while I'm reading the paper. So that's present tense. The past tense is always when you're describing the actions you took to carry out your study. But present tense is used in the method section to describe, either a table, or for example, this phrase like this: in this paper, we present results mainly from 2 questions. Like, you wouldn't say we presented results, because it is happening as the reader is reading this. So you would use a present tense. If you're unclear about this as you're writing, feel free to mark those passages, make a note, and you can always ask me specific questions about that, because that sometimes can be a little bit challenging. Especially, I find English is not my first language, and sometimes that can be a hard determination. Should I use the present or past tense? So if that's something you're like, oh my God, I'm going to freak out about this, as you're drafting, where you're like, I'm not sure to use present or past tense here, mark it, highlight it, let me know about it, and we'll take a look at it together. It's really easy to determine that. So sometimes you're gonna need maybe a second pair of eyes, and I'm happy to do that for you. Let me go and clear my drawings. There we go. And so passive active voice, right? It's hard to avoid in scientific writing in general. Use active always when you can. We're going to talk about this in greater detail in a few weeks, months from now on, when we focus on passive versus active voice. But in this section, don't worry too much about it. But I do want to show you an example. And actually, I did this with a group, with Henry's group a couple of years ago, the Mereti folks over in Egypt. So this is a passage from this article on the support for euthanasia. And if you take a look at this, it's all past tense, right? So I'm going to mark this here for you. Were performed to analyze, were associated, was dichotomized, were included, was performed, were calculated. And it's perfectly fine. Obviously, it was published, right? So nobody took any offense to that. And honestly, if I would be working with this on an editorial basis, I'd be like, fine. But in the spirit of like, hey, is there maybe a way to make this more active? Because it does make for a better reading experience. I want to share the slide with you that we worked on with the group a few years ago. Henry, I don't know if you recognize this, but we worked this, was an online session too. So we took a look at this and we were like, okay, what are some of the sentences where we could change maybe passive to active. And the first one maybe, so rather than saying were performed, first we performed logistic regression as you analyze blah, 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 in which factors were such as we kept the passive here, right? Let me use a different color for the annotation. Use blue here. So we kept the passive here, but we changed it to active voice here, right? So we're associated with this, the 5 Likert scale was dichotomized. You could say we dichotomized the 5-point Likert scale, but it's not that relevant that you did it. Obviously somebody did it. It's more about the Likert scale. But then maybe the next sentence, we included all demographic and health factors rather than were included. So we changed this. We used manual stepwise backward selection to identify, and then we kept the passive here. And so these are, I think that I remember the rationale at the time was like the folks in the group felt like these were steps where it would be maybe important for the reader to know that the researchers performed those. They're more central acts than maybe some of the dichotomization of the 5-point Likert scale. And it just breaks up the flow of passive right in here. It is not necessary. It's another option. Just want to make that available to you and show you what I mean by like how you can change passive to active voice. So I thought this was a good example to demonstrate this with. And we'll revisit this when we get back to the passive voice a little bit later. Let me see how I'm doing in time. Okay, I have a few minutes here. Let me see what my next slide is. Whoopsie, there we go. Oh yeah, actually one more slide and then we're going to stop with the results and we'll figure out how to do the results a little later on. I might have to do some changes to the schedule. So active voice, here's a great example from the study in Ethiopia, also BNC Medical Ethics. If you look here, everything is active voice. And the authors do that because they use, so the first question asked rather than respondents were asked about. So the first question becomes the actor. The first question asked, how often, blah, blah. To answer this question, they're using, we asked them to check a list. The development of these questions had a sequential exploratory, so it's active voice, and we first collected. So everything here is active voice. Asma, passive voice example, absolutely. There's never anything. Passive voice isn't grammatically incorrect or bad necessarily. It's just that there is a tendency in scientific writing to use a lot of passive voice, and it creates often a distance. It makes it harder for readers sometimes to follow exactly who is doing what. And that's really important. The English language really drives on like, Tom kicks the ball, rather than saying there is a kicking action taking place between Tom and the ball. Well, who's kicking the ball? That's what I want to know, just as a simple example. So I'm a big proponent of when you can infuse some active voice, but in this section, it's not the most important part. It is much more important in the introduction and discussion section. So there, I'm going to really, when I review some of your work, I'm really going to focus on like, hey, could you change this passive to active? So, but it's not categorically bad. So the other one is perfectly fine. Yeah, Yildiz, that's a really good point. This sort of using the we, well, you wouldn't use the I, because rarely is it just you one person publishing. So it's usually always the we. And it's even uncomfortable, Yildiz, for a lot of writers, even in sort of Western cultures. And, the Germans don't do it at all. They're like, what? Too crazy.
It's not accepted to use we, maybe we can use the researcher or the authors rather than we. It is not accepted to put we.
That's very interesting. So I think if you were doing this for a journal that's international, national reading audience, I would just use the passive voice, because I find it's like the research and the authors, well, just say we. It's becoming more and more accepted in a lot of publications in North America and in Western Europe. So it depends on the journal you're publishing in. So, and I think the other thing that you might want to do, not just have a list of those 3 to 5 journals, but take a look at some of the, at some point in the next few weeks, take a look at some of the most recently published articles in those journals. And if some of these journals use we in them a lot, then it's safe to use. But you're absolutely right. There's some cultural, some cultural conventions where folks are like, oh my God, this is something we don't do. And then you don't do that. So it depends on where you want to publish. Let me see somebody. So that's a very good point, Yildiz. Thanks for raising that. Jeanette, I noticed that a varied use of active passive voice. Yes. Yeah, so I think it's really that sort of balance that is becoming the norm and really a best practice approach in many of the journals that are published in North America and in Western Europe a lot, and many of the international journals are published from like Elsevier, those publishing houses. So if those are journals you're targeting, you might have to adjust some of that, and it might feel weird to you, and I totally get it. It took me, I'm very used to using I when I'm writing in my academic training, because I'm a historian slash anthropology, social science kind of, and a lot of that was about writing ourselves into the text. That was actually really important, but that's not the case in many other disciplines. So it is, if it feels uncomfortable, it's okay. And you might not have to do it, depending on where you publish. All right, so we are at the end of the hour. We didn't get to results, so I'll work with Henry on adjusting this and doing another, probably focusing on the results section in 3 weeks. I think there's some wiggle room that I built in there for that. Any last questions, comments, thoughts on methods? I hope this was helpful to get you in the mindset of where you are. Again, start writing the methods section as early as possible. And know that you'll have to probably revise it a few times, like anything, and that's perfectly fine. It's actually, I think it's really good to start becoming really comfortable in revising your writing many, many different times. It is sometimes, in my own experience and working with folks for whom English is not the first language or the primary language, it's often a little harder to accept that, because you're like, oh my God, it took me so long to put this in English on this page in the first place. I don't want to go and revise everything again. But that's when you really become a much more effective writer. It's the revision process that really makes the big difference down the road.
Let me respond to Galvez put down. It's using the passive tenses is the appropriate thing to do because of the Egyptian culture. I really don't know what that means, Egyptian culture. I think that it's probably more appropriate to say it's the academic culture, because the academic culture is in the US had been to use the passive voice, and it's I don't know what you think about this, but I think it's only in the recent like 5-10 years that people started to use the active voice, and it really is becoming a universal thing. And so I guess one could say it's the Egyptian culture to write in Arabic. And
no,
I
didn't
believe
mean
in
that.
But I think that as Isabel showed in one example of someone using a passive tense, and it was published, so no problem. But I really think there is a reason to use the active voice, and that is to maintain the engagement with the reader, and so there is a utilitarian reason for this. When we're not trying to impose Western ideas on the Egyptian culture, so so think about that.
I get the others, because I think that, I remember talking with some German colleagues of mine who haven't published in English a lot, and they were publishing, and these were humanities folks and I was doing some editorial work with them on their stuff, and they're like, and it was so passive in their English, and I'm like, look at the way that these articles are published, and they're like, but how can you? It's like writing like a journalist. I'm like, yeah, that's not a bad thing, because people will understand you. So I think there is that, it might be overlapping with Egyptian, but it really, I absolutely agree with you, Henry. It's a real sort of old remnant of this sort of idea of we can't use we because that will reduce our level of objectivity, which is really not true. I mean, people know it's not like the people doing this work, and so I think there is other ways that we can create measures of objectivity to a work, I'll study design and so on, right? That's much more important than if we use we or not. And it really does make for better readability, especially in texts that are so complex. They discuss complex phenomena, complex structures, use a lot of jargon because they have to. And then you add passive voice on top of that, and it's impossible at times to really fully understand. And I think from an ethical perspective, we really owe it to the world as researchers and scientists to make our work as accessible as possible within the given confines of academic publishing. But passive voice also has its place. And we'll talk about this when we talk about paragraph structure. Passive voice can be a really good tool to also create a good flow within a paragraph, depending on how you organize your information. So your goal should not be to completely take away passive voice for the rest of your writing, but to be really savvy and strategic when you use it.
So, the take-home point is when you read journals now, articles in journals, notice what kind of voice is being written, and see for yourself. See which I mean, maybe it makes no difference when you're reading it. Some people skip over the methods section, so you're not really looking at it anyway. But take notice of that. And in fact, when you read articles now, really pay attention to how the authors have constructed their introduction, their methods, their results. I remember when I first started out, and I used to look at articles that were well written and to notice their style. And if I thought it was a good style, I would embrace it and use it when I was writing. It's okay to take a style. You can't, obviously plagiarize, but the style is in the common domain. And so pay particular attention now when you read the articles for the voice, for the style, the structure. It will pay off. It will pay off.
You know what, I will create a forum on the scientific writing section, because it will be really interesting to do as you're continuing to review literature for your work. And, you read it, of course, for the content. But, as Henry said, start paying attention to is there one or two sentences that you think are really well constructed, that are, wow, I often think, I wish I could write this way. Right? And you copy and paste them, and we can create a forum where let's share some of these and explain why they're so good, because there's a lot to be learned from the way that, author X expresses something in whatever section of the article, and share this with other folks. So I'll create a forum for that, and we can do that continuously for the next few months, because you'll all be reading a lot and be like, oh, this is a really great expression. Like one of the reasons I like the term examine a lot is because I remember reading it in one of my early graduate articles. I was like, oh, I really like I like the sound of the verb. I really love the way it was fitting in the phrase. And I would keep a journal. This was still handwriting at the time. This was in the 99, 2000. So I had a computer, but it wasn't, I wasn't as online as I'm right now. And I would have like a little journal, and I would write down physically in handwriting, a great sentence. And I would, highlight the verb or the phrase that I really liked. And then I would start using some of these phrases and expressions in my own writing. And I think it's a vocabulary-based approach, right, to learning language. But it really, I recommend this to a lot of the writers I work with who are native English speakers, because again, academic writing, academic scientific language, that is not it's not a born language for any. Nobody is born speaking academic English, I hope. Right? So we all have to learn it. So let's make it, kind of transparent. And somebody earlier was asking about what section to read of an article for, like, if you need to get something quick. That's a really excellent question. I usually skim the intro and go to discussion. And, you know, like, what are the main, discussion section is really like, what are the main results of the study? Sometimes I go right to the discussion section. And if I'm like, okay, what's the point of this? I might need to go back to the intro, and then I might need to go back to the methods and results. But that's been always like, I read the abstract. If I determine it's interesting, I go to the discussion section. I see how the authors contextualize their findings. I might go to the intro, and then I might go to methods and results. But often I don't have to go to methods and results to get a main gist of an article. Just, you know, to answer that. And there's a couple of more things in the chat. Let me add to that. So Abir, some research textbooks recommend using active voice in terms of researchers instead of I and we. You know, there's different recommendations out there. I'm not a big fan of this, like, third researchers, like, you know, because like the authors discuss. I'm like, well, you are the authors. Why are you talking about yourself in the third person? But if your publisher says that's the way you have to do it, then you do it, right? I mean, you do whatever the journal wants you to do in order to get published. Is there any guide that exists at this moment that would help us decide when to use active versus passive voice? There are lots of articles, and I'll make those available to you about, you know, using active versus passive voice in scientific writing, but there isn't, you know, it's really, I think, try to use as much active voice as possible. And that really is difficult to do when you've been in science for a long time. And so if this is hard, that's okay. But, you know, that's the general rule. But there is really, that's the guide that exists. I do have as I said, a few blog posts and some articles online that give some additional examples. If you want to take a look at those, I'll make those available to you on the Moodle platform. Give me a few days to do that. I have some grading to do in one of my classes today. I won't get to today, but I'll probably get to it on Tuesday or on Wednesday. And I'll send an email out to everyone when those things are uploaded. So, you know, and part of it is, Jeanette, you kind of have to, you know, really, when you're working on it and you're on your manuscript, kind of review your work with that lens of like, okay, how much active versus passive voice am I using? So there is no easy kind of like, you do this and you're good for the rest of your life. Discussion section is the spirit of any article. Absolutely, it really is. It definitely is. The discussion section, I mean, all parts are important, but it's really about how you analyze your results and contextualize them for your audience. That's why the discussion section is the hardest to write, because it is probably the one with the biggest, you know, the most high stakes one to write, the most high stakes one, because you have to do a lot in there, but it's also the most exciting part of your article. So we'll reconvene again like this with the squares in Zoom in 3 weeks, but there'll be some things to do for you on the Moodle platform in a few days and to review. Anytime you need, you know, email me. I'll put my email address again in the chat just in case, although you should all have it. I don't have to. I just sent you an email this morning. Hello. So email me with any questions. If they come up, I'll be happy to answer any questions. Try to find any additional resources for you based on specific questions, because sometimes you might have a question that is very specific to what you're doing, and I'll be happy to assist in whatever way I can. Okay.
Okay, very good. Excellent. Okay. All right. So I will announce between now and Isabel's next session, we'll have another session about the validation process. I don't know if it's going to be next Monday or maybe the following Monday. Okay, but stay tuned to your emails as I know you all do. Okay. All right. Very good. Excellent. We're going. Oh, and the other thing is, I meant to send out a notice to the faculty. We're gonna need to schedule a live virtual session where people could have a chance to discuss their protocols with the faculty. There's just sometimes so much that you could do with the email conversation. So I think it's time to have a live sessions, you know, like a group of six participants with the faculty, and we'll discuss it in real time. So that's forthcoming as well. All right. Okay, Isabel, thank you so much.
My pleasure.
That was fantastic. Okay.
Thanks.
All right.
Bye, everyone. Have a good day, evening, morning, night, wherever you are.
All right. Have a good
Thank you
day.
so
Stay
much.
safe.
Lovely presentation.
Bye. See you soon.
Thank you.
See you.
Thank you.
Bye-bye. Thank you.
You're welcome. Bye-bye.